Every year there's a team, and then the focus, the target group. Last year it was Love Your Eyes, and we targeted the children. This year we are focusing on the workforce, because we realize that we have many workers who do not pay attention to their eye health. Vision impairment has serious impact on the workforce, their education, their quality of life, even their employment. So this year the focus is on the workers to ensure that every worker prioritize their eye health, goes for eye check, and also for the employers, not just to be happy that they have people working for them, but to ensure that they create the necessary environment for the workers to deliver, to be productive. Research has shown, even the slightest, vision impairment can result in about 10% of loss of productivity. So it's very important that we emphasize the need for workers to check their eyes. And also, moreover, we've talked about conditions like diabetic retinopathy. These days, with our lifestyles, some of the workers and our office workers, they don't go out, they don't exercise, and that can, and some eat very late, and all these are factors that contribute to the development of diabetes. And diabetes that is not well controlled will result in, what we call diabetic retinopathy. Affect the eye. There will be bleeding, swelling at the back of the eye, and if this is not treated, early, it results in, permanent blindness, and that's and every worker that loses his or her sight, it's a blow to the economy, affect the economy. That's why we have seen that research has shown, even globally, over $411 billion is lost each year due to the poor eye health of workers. So that is why we are concentrating on workers, and then also the employers, to ensure that they support their workers, the employees, to check their eyes so that they can deliver, they can work effectively as they ought to. One of the causes of blindness in this country is corneal opacity. You see, when the front part, the glassy part, becomes opaque as a result of injury, dark conditions, okay, and infections, they can result in that. They need what we call a cornea transplant. There's a surgery that's needed to use a tissue from a dead person who donates that, and then it's used to be transplanted, and so that the person can see clearly. Currently, we don't have any legislation covering that, so that is why there is a need for us to have a legislation that would help us have this bill, so that people can donate their organs, and then those who suffer from corneal opacity can benefit from this procedure, so that they can see. Because we've seen example of young people who can no longer work because they have poor eyesight, they cannot see, and the only way that eye cornea problem can be solved is through surgery. And so without the tissue, it is impossible for them to do. A few of them are fortunate, because some volunteers bring some tissues from the US, and then in the Kolebu and then Konfanoti, and these few people have their, the transplants done for them, and they are able to return, back to their workplace. And we've had, few people who have, testify of how they benefited from this procedure, and that is why we are pushing. And currently, it's a draft bill that has been submitted to the Ministry of Health, and to eventually end up in Parliament. You should, prioritize your eye health. Normally, people go to the eye clinic when they have pain, or usually when there's pain or redness. Even when there's no pain, they don't go. You don't wait until you have pain. Go there and go to the eye clinic and have your eyes checked. And we have mentioned that one of the conditions, which is the second leading cause of the number one cause of blindness, cataract, which in some of the rural communities, they keep the old people at home. They say, oh, the person is blind, therefore that's not. Some of them, when you go, they have cataract, and a simple procedure, cataract surgery, less than 30 minutes can restore their sight. But they are there, so you don't. You must encourage those ones who cannot see to go for eye checkup. Yeah, we have also mentioned about glaucoma, which is the second leading cause of blindness in this country, which is common, which is worrying. It affects, quite a number, about 8% of the population affected by glaucoma, and this condition is a silent one. There's no pain, there's nothing. The pressure keeps rising, and if you don't get your eye checked, tested, you wouldn't know. And unfortunately, some of the people present to the hospital very late when they can no longer see. And for a condition like glaucoma, when you present when you can no longer see, it means there's little that can be done by the professional, eye care professional. That is why we are encouraging them to have their eye check. Okay, at least once a year, go to the eye clinic.
Who doesn't love a nice bar of chocolate? As you all know, Ghana is one of the biggest producers of cocoa in the world. But do you know how this is being produced? There's a lot of near vision required for producing cocoa. So cocoa farmers are using hand pollination to pollinate their trees. So they go with tweezers into the stem of the flower, take the flower and go and pollinate another tree. That requires near vision. Near vision is easily corrected, but it goes down as soon as you're getting older. It's a natural process. So for us to make sure that these farmers, once they get older, still can have access to do their work and to hand pollinate trees, we need people to have access to screenings, and we need people to have access to eyeglasses. And so this is a simple solution, a very affordable quality solution that's available. And so what we're trying to do is to reach more people in the farmers' communities through working with, for example, the Cocoa Board, to reach their farmers and to do their screenings. We asked the question on why it's important for some of these things to be added to National Health Insurance and how it's possible for National Health Insurance package not to collapse. It's not easy for National Health Insurance to add many things to their package, but often it's important to know how it benefits the country in productivity. So this one, if we add glasses to our basket of goods in terms of the National Health Insurance, it will increase productivity for many of our people in our communities, which then in turn will get revenue for the country. So this year alone, we are screening 60,000 farmers in the Ashanti region to make sure that they have access to glasses and provide them with a cheap, affordable pair of glasses. So we are planning to screen in the agricultural sectors over 6 million people in the upcoming years, so that these groups are indeed given access. So we do communicate, we work together with the Ghana Health Service, and we work together with other partners and implementing partners to get that done.
For more news, please visit our website graphic.com.gh or follow us on Facebook at Daily Graphic and on YouTube and Twitter at GraphicGH.
Subscribe now.